Hello and welcome to this virtual advocacy session. My name is Lacey Kennett. I'm the Director of Communications for the Alliance for a Healthy Kansas. And today I wanted to give you an overview of the Kansas legislative session, kind of do a legislative 101 type of thing. We'll talk about advocacy and the ways that you can get involved in making a difference in your community and, making a difference in Kansas for health policy, and then also talk about some tools that you can use to combat and identify misinformation. So let's get started. So the Kansas legislature is a part-time legislature. That means that they don't meet year-round. They usually meet from January until April, sometimes bleeding over into May, but usually January to April. There are 125 House members and 40 Senate members. So the members of the House of Representatives are re-elected, or those seats come open every 2 years. And the Senate seats come open every 4 years, which means that every 4 years, all of the seats in the Kansas legislature are up for election. And between those years, I'm sorry, between the years that the House of Representative seats are open, we have what's called a biennium legislative session. Biennium is just a big word. It means that it lasts 2 years. So we have the session each year, but for 2 years running, this is kind of considered one. We'll get into it. I know it sounds really confusing. But during that time, if a bill is introduced, it stays alive or active for that full 2 years. So like I said, we'll get into it a little more, but I think that was important to know. So the biennium for the 2026 legislative session that we're in now actually began in January of 2025, and it will end when this year's session concludes, likely in April of 2026. And then the new biennium will begin in January of 2027. So there are leaders in the Senate and the House, just like on the federal level. In the Senate, the leader is the Senate president. Right now, his name is Ty Masterson. In the Kansas House of Representatives, it is the Speaker of the House that leads. His name is Dan Hawkins. In general, they are responsible for overseeing the way that their chamber operates, and that can include determining what committees each legislator sits on, what bills are assigned to what committees to work on, and what bills and topics are talked about on the floor of each chamber. So they have a lot of authority in that way. There are also other leaders in the legislature that are important to know about. There's a majority and a minority leader. So right now in the Kansas legislature, the Republican Party is the majority. So they have a majority leader, and then the Democrats have a minority leader in each chamber. They also have, this is a fun one, the minority and majority whips. The whips are really important because it is their job to kind of be a liaison between the members of the chamber and the leadership. So they may go around and let people know when there's going to be a big vote happening. They may count heads of, who's going to vote how on what. So they're really important, as well as committee chairs and caucus chairs, which are also very important. As far as the legislative process goes, let's just do a refresher. I think hopefully we all learned this in school, but I know if you're like me, you might have forgotten. So once a bill is introduced, then, and we'll just say, for example, in the House, a bill is introduced in the House, and then it will be assigned to a committee to work. Now, there are a variety of committees. Some of them are budget committees. Some of them are there's health committees, things like that. So often, not always, but often it will be assigned to a committee that usually covers that topic. Then if the committee chair chooses, there may be a public hearing on the bill. And what that means is that is the time when people, the public, organizations, all have the opportunity to submit testimony. You can submit written testimony, or you can submit oral testimony, which also includes a written piece. Written just means that you are submitting it for the record. You don't need to be there or talk. If you submit oral testimony, it means you're going to be there the day of the hearing and stand up at the microphone and tell them why you do support the bill, you don't support the bill, or in some cases, there may be state agencies and organizations and people who submit neutral testimony, which just means here they have some information that they want to present about this topic. They're not saying one way or the other whether it should pass. This is a great time to have your voice heard. This is when you can write what your thoughts and write what you want and get it submitted for the official record. So once the committee has the hearing, then sometimes they'll work the bill, and what that means is committee members might want to make amendments to the bill. They might want to change or add or delete based on the testimony that they heard during the hearing. So they'll work the bill, and then the committee will vote to pass it out of committee. Most of those committees just have, maybe 10 people. I don't know, they vary a little bit, but so it's just a very small part of the chamber. So they'll vote to take it to the floor, which means they want the entire House to vote on it, all of the 125 members. They'll take it to the floor. If it passes out of the House after they debate and vote on it, then it will then move to the other chamber. So in our example, we started in the House. So then that bill that has just passed the House is going to go to the Senate, and it's going to go through the whole process all over again. It's going to be assigned to a committee, go through a hearing, be voted to pass out of committee and onto the floor, and the whole process. If it passes both the House and the Senate, that is when then it goes to the governor's desk for either signing or vetoing. If it's signed by the governor, then it is signed into law. And if it's vetoed, then it can go back to the legislature. And if they decide that they want to override that veto, both chambers can pass it again. They do have to pass it with a supermajority. So they have to have more than just a majority. They have to have a supermajority to pass through it. And then if they do that, then the veto is overridden and it becomes law anyway. So I know those are really fast, general, there are hiccups and things here and there, but in general, that's the process of a bill becoming a law. Okay, so this year's legislative session is running similar to last year's legislative session, and that is to say they have shortened it significantly. So right now, the 2026 legislative session is scheduled to last from January 12th to April 11th. There's a goal for them that some legislative leaders have talked about in the media and whatnot. There's a goal that they want to try to cut $200 million from the overall budget. So that is something to watch, where those cuts are going to be made. There's also, you may remember, the one big beautiful bill that was signed into law at the federal level last summer, in the summer of 2025, that made big historic cuts to programs like SNAP and Medicaid, and that's going to have a really big impact on states and their budgets. And so this session, look for some talk about how that's going to affect Kansas, and particularly budget-wise, what that's going to do. There's also potential to talk about redistricting. Haven't heard as much on that. Don't think, we've heard publicly that they don't think the votes are there. It's always something to keep in the back of your mind. Also, as part of the One Big Beautiful Bill, there was a rural healthcare fund that was created, and that is a big chunk of money that's going to come to the state, and you'll probably hear some people talk, some lawmakers talking about how that money should be used to benefit the healthcare system, particularly in rural parts of the state. So those are just a few things to look out for in this space. There's a whole lot of other stuff, but we're going to try to mostly talk about the health area. As far as Medicaid expansion goes, like we talked about, we are in the second year of the biennium, which means that two Medicaid expansion bills were introduced last year. And then this year in 2026, we actually have two more Medicaid expansion bills. So that's a total of four Medicaid expansion bills that are currently on the books and could be passed or go through the process. The ones from this year are the ones at the top of this slide. We consider them clean bills, and that just means it's straight Medicaid expansion. It's as straightforward as you can get. Those are HB 2600 and SB 457. They're both called the Affordable Healthcare for Kansans program. They implement that. The other ones that were introduced last year are HB 2375 and SB 257, both of those called the Hawk Act. And those are Medicaid expansion, but they also include things like a work requirement. So they're a little bit different, but they're all Medicaid expansion bills. As you can see, the two in the House both are currently in the Committee on Interstate Cooperation, and the two in the Senate are on the Committee on Public Health and Welfare and are very unlikely to see hearings this legislative session. But they're there, so. Now let's talk about advocacy. So advocacy can take on many different forms. And, some people are a lot more outspoken and want to be out and seen, and other people maybe are a little more reserved. There's a place for everybody. Advocacy is really just taking some kind of action to create a change that you want to see. So these are just a few of the examples. It can be as simple as having a conversation with people you know, friends, family, neighbors, people you work with, even lower on the city, municipal level. Those are all really important. Getting people to understand the issue and see why it's important. It can be as simple as sharing on social media or even in your local newspaper. A lot of papers have letters to the editor or op-eds that they'll publish, so you could write something and share it that way. You can just go straight to the lawmaker, straight to the legislator, send them an email or give them a call and tell them what your thoughts are and what you want to see happen, what you don't want to see happen. I'd also encourage you to look out for when they'll be back home. A lot of times they'll do legislative coffees or town halls or meetings. It's a great way to talk to them when they're back in your community. And there's also lots of opportunity for attending events and rallies in support of your cause. We have one in March of most years, this year for sure, where we will rally. This picture in this slide is of our 2025 Rally for Healthcare, where we all come together and talk about why healthcare is important and just kind of spend community time like that together. So if you aren't sure where to start, the best place to start is to find your legislator. And there's a number of ways you can do that. This is a really helpful one. If you go to pluralpolicy.com, there is a resources page. You click there and scroll down, you'll see these boxes. And if you enter your address, it'll tell you exactly who your state representative and your state senator are and will give you contact information. We encourage you always to contact both of them. Both are there to represent you. And like we've talked about, sometimes things will pop up on the Senate side or on the House side. It's never a bad idea to let them both know where you stand on issues. Okay, now this is kind of where I start to, I'm going to try not to get long-winded. This is where I get excited to talk about. Let's talk about information and disinformation, because I think as the digital landscape evolves, it feels like daily, right? It changes. It's really important to talk about things like AI and misinformation and disinformation. So for me, the first place that I think to start when we're scrolling social media or we're reading websites or news is just remember that all media has some kind of bias. There are lots of really good publications and websites and traditional journalists who do everything they can to take out the bias. But the fact is, we're all human and we all have some kind of bias. So it's a good idea to remember that when you're looking at things. Some of the ways that you can look at that would be to start with the headline. Headlines are always created to get clicks, right? That's oftentimes the journalist doesn't even write the headline. Somebody else, an editor or a digital editor, will write the headline. And the whole point of that headline is to get your attention. So that's why it's dangerous to just scroll and say, I saw a headline. We all do it, I think. But that's why that can be a dangerous game to play. But you can see in the framing of the headline we have here about Medicaid expansion, there are two different ways we can talk about this, right? Medicaid expansion would cover 150,000 Kansans. That sounds great. Or it could cost taxpayers millions. Both of those are written a certain way to make you feel some kind of way, right? So just be aware of that. Some other things to think about. Does the article or story or post tell both sides of an issue? Does it give an appropriate amount of weight to the people quoted or the experts that they refer to? For example, if it's an article or a post about a medical issue, are they giving the same weight to a medical doctor and me? Don't do that. I don't have any medical training. I should not be given the same amount of expertise weight as a doctor. So just think about, who are they interviewing, who are they quoting, and are they the same level of expertise in the topic? Let me see. You can also look at the language that they use. On the slide, I talk about loaded language and emotionally charged terms. A lot of times they'll use words to make you feel a certain way. So before you just accept the claim that's being made, especially if you read it and you go, oh, I've had those moments, you read something or you see something, you go, oh my God, and stop. The good thing to do is stop and think about how you feel and what words they're using before you just accept what's being said. Um, there's the pictures on this slide are from an organization called Adfontis. I think I'm saying that right. And they're an organization that really seeks to give a visual idea of where the sources that you might be getting information from fall, as far as the credibility of the sources that they use, as well as does it lean politically to the right or left. So you can see here on the top to bottom, the higher up on the chart, the more reliable and the more accurate the sources are. So they're doing fact analysis, they're talking to experts, they're talking to reliable people toward the top, and then toward the bottom is less reliable information. So I think of that as like an investigative journalist talking to lots of people over a period of time and looking at data versus at the bottom, a gossip blog or website. Like they're just speculating. They're not talking to anybody. They're not double checking. And so that's the top to bottom. And then of course, the right to left is the political bias, whether they lean right or to the left. And is it kind of a little bit that way, or is it all the way extreme? So you can see here, if you're looking to get information, which I hope you are, from the most reliable and the most politically moderate, neutral, I should say, politically neutral information, I've kind of blown up here that top. You can see that like the Pew Research Center, Reuters, the Associated Press, the BBC are all kind of in that at the top, in the middle, a good place to get that. This chart happens to use like the stoplight colors, which I find really helpful. You can see the green that's highlighted there. If it falls in the green, they consider it to be a really reliable source. If it's falling in the yellow, which is outside, that you can see on that larger chart that it's the more extreme right or left. You just want to be aware of where that's falling and what kind of bias it will have. And then as you go toward the bottom, then you've got less reliable, and that's the red light. Be careful if you consume this content, just know what you are consuming and how reliable it is. So they update this regularly, so by the time this goes out, they might have a new one. So like I said, you can just look up Ad Fontes media bias chart and you'll probably see the most recent one. Okay, with more and more AI generated content, I also think it's important to talk about that because when I'm scrolling, particularly on Facebook, unfortunately, I see an alarming number of posts that are clearly AI generated or like automatically generated. And so I think it's really important to remember that there are statistics that show that up to half of what you see on the internet is not done by a real person. And so remember that as you're scrolling, up to half of what you're seeing is AI generated or from bots being just automatic accounts that aren't related to any individual person. Some common signs that you're seeing AI content is that it sounds really good, but it's very vague. It doesn't have quotes from people. It doesn't name people. It may not have specific dates or locations, or it's just very general. And you could read it almost anytime, anywhere, and it would apply. That's a really big sign that something is AI generated. You should also look for accounts, like I said, that may not be attached to a real person. Some of the ways you can identify that are that it doesn't seem to have, they use the stock photos. There's not a lot of like real people, places in that account. If there's high volume posts, and I'm talking like 5, 6 times a day, they're cranking out these posts that have that are long posts that are well written. There's a decent chance that it's AI generated. Not always, but it's good to look because that is a lot of content for one person to make and publish every day. If you see that it has a lot of likes, but it doesn't have very many meaningful comments, that's another sign. By meaningful comments, I mean if a lot of the comments are just emojis, or if they're really short phrases that are pretty generic, those are what we would not consider meaningful comments. Those are likely bots that are doing that automatically. There's a computer doing that in order to boost it in the algorithm so more people see it. So just take a look at that, see if the people commented. You don't have to agree with it, or it doesn't have to be, you know, if there's misspellings or whatever, that's fine. If it appears to be a genuine person is what we're looking for. So my other I also wanted to point out that there are I have run across websites that look like news websites. And if you look closely on the page, it will say this news article was created through AI data gathering. Be careful of those too, because that means it's just searching the web and then it summarizes a bunch of things that are read. It doesn't necessarily mean it's inaccurate, but you should be aware that that's how it was created. Some tips, like I said before, pause before resharing it or reacting to it, especially if you have a big reaction to it. That's a big sign that something might be skewed. I have fallen for it. I think we all fall for it, but just try to remember that. Check the account history. If you see a photo that makes you question, you can always do a Google reverse image search. So you would go to Google and you can drag and drop on a computer, or you can upload a picture into the Google search bar and it will actually pull up, it'll search the web for all of the places it can find that picture and show you all those websites. So but before I did this job, I did emergency preparedness. And so we would see, there was one in particular that you would see pop up every so often. And it was usually when there was flooding or there was a hurricane or something. It was a photoshopped fake picture of a shark swimming down a flooded highway. It wasn't real, but it would pop up every single time. And so if you see something and you go, you can do a reverse image search. And if you did that, it would pop up that for the last 15 years, people have been showing that picture and it's not real. So, as far as topics and facts, Snopes has been around a really long time and is really good for fact checking. Factcheck.org is great. MediaWise is great. Another one for images is called imagewhisperer.org. And what I really like about that one is you can upload a picture and it will do its computer analysis and it will give you the percentage of likelihood that an image was AI generated or not. And I like it because it doesn't just guess, it'll tell you, hey, I'm actually not sure about this one. This is why I think it might be, this is why I think it might not be. So I really like that website too. And it's one I think that is lesser known. So I wanted to point that out. So then we had a request to go through disinformation and misinformation that you might find about Medicaid expansion or Medicaid or healthcare in general. And I wanted to do that, but there's so much to go through. So I thought instead of going through specific arguments that you might hear, that we should talk about fallacies, because in general, a misleading fact or disinformation is going to use some type of fallacy to confuse or mislead you. So I want to look at some of those now. So the first one is the appeal to tradition or appeal to common sense. We see this one a lot in general. You see it in all sorts of areas. The general idea is we've always done it this way. So it assumes that the old and familiar policies are better than any kind of change because it's familiar, right? It can frame certain issues as being obvious or common sense or fact. And in that way, it discourages talking about any potential changes or improvements. So it's good for you to remember if somebody presents something that says, we can't do Medicaid expansion because this is the way we've always done it. And, we know how to handle this. If something is common sense and if something is the best way to be done, it will hold up to scrutiny. It will hold up under research and data, and it will not melt under those conditions, right? So just kind of remember that. The nirvana fallacy is one in Medicaid expansion that I see more than anything as I'm looking online and in media and in all corners of the internet. So the nirvana fallacy basically is the thought that if a new policy is not perfect, it is not worthwhile. So we see this when people will say, well, we can't do Medicaid expansion because it is inadequate with reimbursement rates for providers, for doctors and hospitals. So the person arguing against Medicaid expansion in that case is basically demanding perfection from a new policy. It's holding it up to the ideal standard while simultaneously giving a free pass to what's happening right now. It doesn't require any scrutiny of what we're doing now, but demands perfection from something new. So it's important to remember when you encounter this that something doesn't have to be perfect to be helpful, right? The sunk cost fallacy. That's the one with the cartoon here on the screen. And I just love this little cartoon. The sunk cost fallacy happens when people choose to stick to an argument or a policy position just because they've always believed that or they've always done it that way in the past. This is kind of a human nature. We don't want to be wrong and we don't want to waste our time or our money or our resources, right? And so in this cartoon, you can see the dog is looking for his bone. He buried his bone. I'm not sure where it went. So he starts digging and his little friend comes along. And once the dog has gotten deeper than the bone would be, logically, his little friend says, I don't think it's there. And the dog says, but I'm already so deep. I can't, like, look how much time I've spent digging this hole. I can't just come up and start again. I just got to keep going. It's got to be down here. And then you can see he keeps going, and it's obvious that the bone is not there. The bone was a little to the right there on that comic. And if he would have just stopped and gone up and started again and looked at it with fresh eyes, he might have found the bone, but instead he's in a hole. So that's kind of the sunk cost fallacy. It's an easy trap to fall into, like I said, because people aren't really inclined to say, oh, I was wrong for all those, it's been 10 years since Medicaid expansion has been around. And uh, there might be people who would not want to say, well, I think I was wrong for the last 10 years. That's a pretty rare thing to happen. That's why people fall into it. It's important that we look at things with fresh eyes, and if something isn't working anymore, it's okay to change. And then the last one on this slide is false balance and false equivalence. This is a fallacy, kind of similar to what I talked about before, where someone will try to give equal weight to two sources or two places that should not be given equal weight. So I think of this, let's say that there's a journalist, well, we'll say this, you wouldn't find this. You wouldn't find a journalist writing an article for a major newspaper about whether the earth is round or flat. Uh, but just imagine that they did, and they went and they found NASA astronauts who have been to space and scientists and all the people who do all the smart space things. And they say, the world is round. We've got pictures. I've seen it with my own eyes. And then they go to a middle or high schooler who found a blog of somebody that says the world is flat. Responsible journalism and responsible arguing would not equate those two sources. That might be both sides. You hear people say, well, you got to tell both sides, but you have to give the right amount of weight to it, right? We don't weigh the people who just looked at the internet to the people who have been to outer space. So I hope that was helpful in understanding that. It's just a way of confusing the issue and making people feel like maybe the issue isn't settled and the research isn't clear when actually it is. Okay, a few others that I just wanted to go over real quick. Sea lioning is my favorite named fallacy. This is a tactic that are used by people whose goal is to delay and introduce skepticism in bad faith. So if you are having a conversation with somebody and they keep demanding more and more answers, I need more facts. I need you to answer this question. It just goes on ad nauseum. Their goal is not to get the answers from you. Their goal is to either wear you down and exhaust you until you stop or until the clock runs out. It's a really good way of protecting the status quo and making people feel like they have to keep showing proof when they've already done that, right? And this is just a clip. I encourage you to go find the whole cartoon, but basically the sea lion just keeps asking them questions, and it's all in the name of why I'm just asking a question, right? But it is in bad faith. So thought terminating cliches are another way that can block change, because a few examples are things like, it is what it is, or nothing's ever going to change. Those are statements that are made in order to shut down further conversation. The goal is not to debate the merits or the actual policies. It's just to stop the conversation. Sometimes people do this, not for nefarious reasons, but just because they genuinely don't know, or it is what it is. The way you can get over that, if you want to continue the conversation, is just, you could ask, what does a solution to this look like if you couldn't fail and there were no limits? What would it look like? What would access to healthcare look like if you knew you wouldn't fail and that you had the resources that were needed? Sometimes that can get over that hump of thought terminating cliches. And then ad hominem fallacy is kind of oftentimes a last resort if somebody doesn't have a way to come back and engage with the policy, then they will just resort to attacking the person instead of the argument. So that is a way that they try to, once again, wear people down, distract people. And so keep an eye out for that. That's usually a sign that they have run out of ways to counter your arguments. There's other important things to look out for. This is not all of them, it's just a few that I see quite a bit. I think that it's also important to become familiar with something called DARVO, which is deny, attack, reverse victim, and offender. So DARVO. And that is where somebody, if you ask a question or come to someone and say, we think that this is wrong and it should be this way, they will deny and say, no, I didn't. Reverse or attack. How dare you do that? That's offensive. And then they'll reverse victim and offender. So instead of me being the offender and you the victim, I'm going to switch it. And now I'm the victim and you're the offender. And so that is another kind of, I think it's usually a last resort. I don't have anything else to say, so I'm just going to Darvo and switch this conversation and throw you off because you're probably not ready for it. Okay, you can look at this, you can pause the video or whatever if you want to look closer. What I did was I went to a website that had an article about why Medicaid expansion is not good for Kansas, which is the opposite of what research shows. And I wanted to show you how some of these fallacies are used in the real world. So you can see here, the overall fallacy that this whole article used was the Nirvana fallacy. It says Medicaid expansion is not right for Kansas because it doesn't solve every single issue that we have with the healthcare system, which is not fair. It's not, shouldn't be what's expected, right? Like we said, something doesn't have to be perfect to be helpful. So I've got kind of color coded here. There's also loaded language in here with the phrase death by Q, talking about paper pushers and healers, trying to get you to automatically assume that administrative jobs in places like hospitals are like not needed, not worth it. You can see the false balance there that I kind of talked about. There's the appeal to common sense, which is like, in this case, the bottom there, they just say, that's not a sign of success. And so you really like stop and think about the framing, the way they frame that as this is how we've always done it, or this is what we've always considered to be a sign of success, and just kind of question the use there. Okay, we're finishing up here. I feel like I've been talking for forever. Thank you for sticking with me through all of this. Some resources that we have for you. This just came out. We actually just, as I'm recording this, delivered these today to legislators at the State House. This is our 2026 briefing book. It is the most comprehensive a single resource that we put out. Hold on, I'm going to hold it up to you here so you can see it's real. Oh, there we go. Kind of. It's long. It goes through all sorts of health topics in Kansas. So not just Medicaid expansion, but we also go over Medicaid, and it talks about the waivers in Medicaid, which can be a very confusing topic. Talks about the Affordable Care Act and the tax credits. It talks about medical debt, all sorts of things. So it's a really great resource. You can find it on our website at healthykansas.org. In the upper corner, you've got the menu. If you click on resources, you can find it there. We will also keep the 2025 version up, at least for now, because that was really a deep dive into Medicaid expansion. And I think there's still some really good information, including how to push back on some misconceptions that you might encounter as far as Medicaid expansion goes. So you can find both of those there. This is a screenshot from the website. So these are under the advocacy tools section. When you click on that resources page, this is relatively new. page that we've redone. And so you can find these under advocacy tools, but you can see there all of the different topics that you can find resources for. And then just some next steps. If you are ready to do something, these are some things you can do. So you can obviously reach out to your legislators. Now's a great time because they're in the middle of the session. They're here in Topeka doing things. Email or calling is the best way to do that. Sharing your story can be a really impactful thing to do. If you have had any kind of encounter with the healthcare system, be that in the coverage gap without access to affordable health insurance, maybe you have incurred a lot of medical debt. Maybe you are somebody who lost the enhanced subsidies on the ACA marketplace. Maybe you're a doctor or a psychologist or a therapist or a occupational therapist or a substance abuse counselor, somebody who works with people in this. We want to hear your story too. So stories really put a face to these policies that is really important when we're talking to lawmakers, and the media is often interested. You share your story with us and you have total control over how we share it too. So if you're interested and just want to talk about it, we'd love to talk to you more. We would never ask you to do anything you are uncomfortable with. So I just put that out there. Like I said, we've got a rally coming up in March for healthcare at the State House. We'd love to have you. We also do virtual events and we travel around the state, especially in the summer and fall. So if we come to a community near you, we would love to have you. You can find all of those on our website, healthykansas.org, under the events tab. Or you can organize your own activity and invite us. That'd be great too. So get creative if you need help, if you've got kind of a half-baked idea and you want to make it happen or you want to talk it out, we'd be glad to talk to you. So this training was originally part of our Healthy Kansas advocacy community, and that is a virtual group that meets twice each month on the second and fourth Wednesday of the month at 7 o'clock at night. It's on Zoom. It's casual. We welcome people from everywhere to come and talk about the current policy, what's happening, ways that you can make a difference. Right now, we're working through a book and would love to have you. The book, look, I'm gonna forget the name of it. Working through it, just talking about it, kind of like a book club. So we would love to have you, whether you are seasoned and you've done this for a long time, or you are just now kind of interested in maybe, doing something. We want everybody from all parts. We have people from all parts of the state join us. So would love to have you. Look that up for our next one, healthykansas.org on the events page. We'll get there and it'll get you the link to the Zoom meeting. So thank you so much for making it all the way through. I think it's been like 45 minutes. That's a long time. Thank you for listening to me. This is our contact information. We're on Facebook, Instagram, TikTok, and YouTube. You can find us. Our handle is at healthykansas.org, and make contact with us there. Once again, my name is Lacey Kennett. I'm the Director of Communications, but I know that April or Marissa or Miss Sarah would love to hear from you too if you've got ideas or want to talk through something. So those are our email addresses. You can find it on our website. Give us a call or email, and we'd love to hear from you. So thank you so much for joining me, and we couldn't do any of this work without you. So we are so grateful for that, and I hope to see you soon.